Omo, now we don reach breast o. Na the topic wey most of una sabi drop person on top be dis, not less than 2000 words. Well the things wey we go treat wey dey necessary when you dey talk about breast na dem be: first of all, we go look the intro, then location, shape, ex ten t, relation, structure, blood supply, nerve supply, lymphatic drainage, and lastly the clinical correlation. Now straight, no wasting of time, we go intro. If you look the breast, na just modified sweat gland wey dey the superficial fascia of pectoral region. Surely you go sabi wetin sweat gland be na. Dey plenty for skin wey dey just secrete sweat. So last breast na just sweat gland wey get levels, and e dey for both male and female. In male, the thing dey rudimentary. Dis one mean say the thing na one chinkily underdeveloped structure. That's when we are referring to male shey. Now the thing wey we go mount next na im be location. I want make you observe that structure of breast wey you dey see for your screen. You go see say that round big part, e dey for the superficial fascia of pectoral region. But you see that triangular abi na conical thing wey dey comot for side, for up, that mean say e dey superolateral. Dem dey call am axillary tail of Spence. E dey enter axilla after piercing the deep fascia, so e dey located for axilla. The hole for deep fascia wey dis axillary tail of Spence dey pass through for deep fascia to take reach axilla, dem dey call am foramen of Langer. Foramen of Langer, you dey see am ba? One stuff wey you fit keep for mind na say cancer of breast fit easily occur for dis tail wey we talk about now. Now na the shape of breast next. The breast na hemispherical bulge, as una dey see for the diagram. E dey circular to some ex ten t and e come bulge comot abi, na why dem dey call am hemispherical bulge. Now for the ex ten t of the breast, ex ten t we go consider am both vertically and horizontally. Firstly vertically. Vertically na from the second to the sixth rib na im the breast reach, while horizontally you go look am from the lateral border of the sternum down to the mid axillary line. Hope say you remember that mid axillary line wey we talk about for my last video. Now make we migrate go relations of the breast. Relations, e mean things wey surround something, the ones wey close, just like in real life now. Since breast dey superficial, nothing dey on top of am, rather e get things wey dey under am. In other words, e get only deep relations. Make we list them. First of all, the first thing wey you go meet na pectoral fascia. Then under the pectoral fascia, you go come meet some muscles. Of course, you go first meet pectoralis major wey dey directly under the pectoral fascia, then serratus anterior for side, then you come get external oblique for down. That is under this after you don pass the pectoralis major up, you go meet the muscle for down. Also, I want make you know say between this, the breast and the pectoral fascia, e get one small space wey dey, dem dey call am retromammary space. This space, e dey contain the loose areolar tissue. Loose areolar tissue na soft type of connective tissue, and I hope say you remember wetin be connective tissue for secondary school before I drag you back there. One of the four main types of tissue na im dem dey call connective tissue, and since loose areolar tissue na soft connective tissue, e dey grant breast the high mobility wey breast get. Na why any direction wey you shift breast go, e go follow am like mouse. Now we go mount the structure of breast. E get like three parts wey dey comprise the breast. We get the skin, the stroma, and then the parenchyma. First of all, we go treat the skin. Under here, we get two important aspects: the areola and then the nipple. The remaining part na just normal skin. Now, the first one wey we go take among them na areola, and areola na dark circular part wey dey around the tip, e dey surround the tip. That areola part, e get a lot of sebaceous glands wey dey secrete some oily stuff wey dey keep that place moist, and e no dey allow am dry or crack. When belle dey during pregnancy, these things dey swell up to form wetin dem dey call Montgomery tubercles. So you see as those Montgomery tubercles mount on top the areolar region during pregnancy abi. The next thing wey we go look at na im be nipple. Na im dey for the tip of breast. Na conical projection dis thing be. E dey surrounded by areola. It is richly innervated by a lot of sensory neurons wey make am responsive to tactile stimulation. Also, e get a lot of smooth muscle wey e contain. So these smooth muscles now, dem dey contract when you stimulate that aspect of the tip of breast. So when you stimulate it, this nipple, e go come become stiff. This stimulation wey I talk about, e fit happen in terms of when baby dey suckle, or when like person dey mood. Now hope say e clear. Now make we enter the stroma. The stroma get two major aspects. E get the connective tissue portion and then the fat portion. Now the connective tissue portion, first of all, e dey in form of small small strands of fibrous tissue wey dey dey refer to as the ligament of Cooper or suspensory ligament of Cooper. Dey dey connect the skin and the duct of breast with the pectoral fascia wey dey under them. Now na dem dey responsible for the way wey breast take dey erect. The way e take stand gallant on top chest for young woman na the suspensory ligament of Cooper dey responsible for that. However, as age dey increase, this ligament dey go begin dey break down, so the breast go come begin dey fall down, like dey go begin dey weak small small. Now make we enter the fat of the breast. The fat of breast na im form the bulk of the breast. In other words, e mean say na im form most of the breast, and the size of the breast go heavily depend on how much fat the breast contain. Now lastly, under the structure, we go look the parenchyma. Under parenchyma, we get a continuous structure wey consist of different parts wey dey function together to facilitate milk let down, meaning say to make sure say milk go comot. Now the parts na firstly the lobes wey reach like 20. They go come open into the lactiferous ducts wey go transport the milk go the nipple side. Near the opening of the on top the nipple, the ducts dey swell up to form wetin dey call lactiferous sinus, wey dey serve as small milk reservoir before the milk go come comot for the tip of nipple. Now we don finish with the structure of the breast. The next thing wey we go enter now na im be the blood supply of the breast. First, we go look under arterial supply. The arteries wey dey supply the breast na three dem be. We get the axillary artery, na very big artery be this. This axillary artery now, e go supply the breast through like three of its branches. The three branches na dem be superior thoracic, lateral thoracic and acromiothoracic. Then the next artery na the internal thoracic artery wey dey supply the breast through some of its perforating branches. They also call am internal mammary artery. Then for the third one, we have the posterior intercostal arteries wey dey supply the breast through their perforating branches. Next na venous drainage na im we go look. The veins dey correspond to the arteries, so na similar talk na im dey there. Na dem be this for your screen. Now nerve supply of the breast na im we go look at next. Him sef is simple. Na the same nerve supply wey dey the skin of pectoral region, that is the part below the level of the angle of Louis. Now as we look at that time, it is T2 to T6, the anterior and lateral cutaneous branches of T2 to T6. Now the next thing wey we go look at na im be the lymphatic drainage of the breast, and na by the following lymph nodes. We get the axillary lymph nodes, internally mammary lymph nodes, the posterior intercostal lymph nodes majorly. Now we get some other ones like the subdiaphragmatic and subphrenic, but you see these ones now, with the first three wey I call, na dem be the most important ones, and you go see say their names dey correspond to the names of the structures wey the arterial supply. So e dey easy to memorize for this part. Now lastly, the thing wey we go look at na im be the clinical correlation wey be breast cancer. Now na topic for another video be this. Go watch am after you don absorb this one.